Access to care is really challenging across the Air Force. Doesn't matter what base you're at, access is not the way it was 5-10 years ago. Steffanie Sargeant, I'm a licensed clinical social worker and I work at 37th Training Wing. I am a retired LCSW in the Air Force, served 20 years active duty, was a licensed clinical social worker opening, and it was working within an embedded setting and not in the clinic. So it was a great opportunity to jump in and do something that I've always wanted to do, and the mission never allowed it, so this is great. Our mission in True North is really to give commanders the tools they need to help keep their forces and their families mission ready. And we do that by intervening early and intervening in the unit if we can, or connecting them with services close by and really trying to keep them as mission ready as possible.
Everybody face the blue podium.
In True North, we're able to help the permanent party. At this time, we're not able to see family members or students other than providing the prevention programs to them. Training instructors have a very rigid schedule, and we have to make sure we're offering services when they're available. We don't want to put additional stress on them. We don't have a problem with people seeking help. We have a problem vectoring those folks to the right support. The mental health clinic is not necessarily the actual agency they need to go to first thing.
By show of hands, who's been stressed out before?
They could come to a lower level agency like an MFLAC or an embedded provider like myself, or they can even go to their primary care provider. They don't necessarily need to hop to the mental health clinic first thing.
You weren't expecting for it to be this way?
We're not in all of the units. We're only in a few units. And the Air Force is rolling out this program to the at-risk units first. And if it's successful and if we're showing that the key performance indicators are improving, then they'll be able to roll it out to other units. Anything we do, we're measuring it. If it's a prevention program, we're measuring it with evidence-based outcomes. When individuals come in for care, there's a session rating scale and there's an outcome rating scale that they'll take. And that helps us understand, number one, are they getting better or are we off track? And number two, is the clinician effective? And those key performance indicators are important for us in the unit. Overall, down the road, we want to look at, are people getting what they need? Are they getting the medical care they need? And if we can track that, we'll have a better understanding if we're making a difference.